Appreciate it, ladies. Botox, it's widely used for cosmetic purposes. We're also talking about migraine headaches today. Lots of people suffer through them, and if you have 2 or more a month, it can really be dangerous to your health. Dr. Marshall White, Allyn White is a board-certified neurologist. He is here to explain. Dr. White, thank you for coming. Tell me about this condition, because migraines, they can really put somebody down for quite a couple of days.
Well, thank you, John. I appreciate your having me on the show again. And well, Botox is certainly one treatment for migraine headaches that we may or may not talk about today, but there are a variety of excellent treatments that are now available for migraineurs or patients who suffer from migraine headache. 10% of the population will suffer with migraine headaches, and if you're having headaches in excess of twice per month, then you probably need to be on some type of preventive medication.
Yeah.
These medications are generally oral medications, but Botox can also be used and is one of the newer medications. If you're not enjoying relief from your migraine headaches, then I would highly recommend that you see a local neurologist to have your headache condition evaluated. Again, migraine headache is not a benign condition. It's the #1 cause of stroke in patients less than 50 years of age.
Oh, wow.
There's an increased incidence of dementia in later life in patients who have untreated migraine headaches. So it's really an important condition. In my practice, I see huge numbers of migraine patients, and I almost hate to talk about migraine today with all this other fun activity going on around here.
What is the difference between a headache, a regular headache, and a migraine? I hear that once you had a migraine, you know you had a migraine.
You know, a muscle tension headache is a common type of headache, but migraine is even more common. Maybe as many as 90% of headaches are actually migraines. A lot of people have low-grade migraine headache and they don't require ongoing treatment, but there's a population out there who has frequent daily headaches, and unfortunately we cause a lot of those problems because we begin to treat infrequent migraine headaches with symptomatic therapies that only cover up the symptoms. And as you use more and more of those medications over time, you develop this wave-like sinusoidal cycle of headache and relief, and that cycle starts to become compressed such that you experience more and more headaches. And if you're in that boat where you're taking more and more medication to relieve the symptoms, you need to be on a preventive. And the frequency is more than 2 per month. If you're using a medication for symptoms of migraine headache more than twice a month, you need to be on a preventive. We can control your migraine headaches as much as 90 to 95% with preventive medications.
So there's some good rates of curing this condition.
Excellent. There's no reason to suffer. So if you are in that boat and you are having frequent migraine headaches, you need to get in to see an expert in the treatment of migraine headaches. It's a complicated disorder. There are multiple types of migraine headaches. Headache can be a symptom that heralds life-threatening illness, and so it's important that you be evaluated by an experienced practitioner.
Dr. White, what are some of the warning signs? I know sensitivity to light is a common migraine trigger, is that correct?
Sensitivity to light may be a feature of migraine headache, or bright lights may trigger migraine headaches. Only about 10% of patients can identify a specific trigger for migraine. Odors, certain food additives such as monosodium glutamate. Also chronic headaches can indicate an unrecognized hypertensive condition, so it's important to monitor your blood pressure as well.
But as you said, there are treatment options available for people. Just a regular pill could get rid of this whole condition.
Absolutely.
Well, it sounds fantastic. Where can people go and get more information about migraines and come and see you if they feel like they need to get treated?
Well, that's my address and my contact information, and I would be happy to see anyone who feels that they're not getting adequate relief from their headaches.
Well, it sounds like a wonderful thing that you're doing. If people come in, what are some of the other symptoms that they usually have or display if they're trying to discern if it's a headache or just a regular migraine?
Throbbing headache, nausea, vomiting. I think the wide percentage of patients out there with migraine headache, they know that they've got migraine headaches. I'm principally appealing to people who know that they have migraine headaches and they're not enjoying near complete relief. If they're having more frequent headaches and they're not enjoying almost complete relief, then they're not getting the treatment they need.
So there's a better treatment and a better way of life.
There are many other excellent treatments out there than just symptomatic medications.
Fantastic. Well, Dr. White, thank you so much for your time. We really do appreciate you stopping by.
Thank you for having me.
Pleasure to meet you, sir. And stay with us. Much more Low Country Live coming up after the break.